Welcome to 21st Century Health. I'm Jackie Bales. With 40 million Americans affected by diabetes and the related costs approaching $200 billion annually, providing quality care to patients while managing the staggering medical costs of this epidemic can be challenging. Dr. Benjamin Littenberg, CEO of Vermedx, joins us via satellite from Burlington, Vermont, to discuss how his company is addressing this issue. Welcome, Benjamin.
Thank you. It's a pleasure to be here.
Benjamin, tell us about the challenges that companies such as yours face today as it relates to diabetes care.
Diabetes is a gigantic problem in America and around the world. It affects tens of millions of people and causes truly awful complications. It's also responsible for a very high proportion of healthcare spending.
Benjamin, who is Vermedx and how are you addressing this?
Vermedx was founded by faculty from the University of Vermont. Our research shows how to take clinical laboratory results and feed them back to both the providers and the patients. The doctors and nurses get flow sheets and reminders and alerts that help them plan better care for their patients. And the patients themselves get first-class mail, letters, that help them stay in the loop and take part in their own care.
For more, let's go to this 21st Century Health field report.
Vermedx Diabetes Information System provides a patent-pending technology that allows for documented improvement in the quality of patient care, as well as a significant reduction in the cost of treatments.
The Vermedx gives us timely information about not only our patient values and how they're doing diabetes management-wise, but more importantly, when they're overdue for testing. That's been a huge problem in the past. It helps keep our patients in the system and reminds us when patients are overdue for visits or testing.
The technology uses automated blood test reports and notification letters to help doctors provide better patient care and quarterly population reports that enable them to identify and focus on patients most in need of immediate attention.
There's been a measurable improvement in our communication with patients, and I think they really appreciate it. One of the things that the Vermedx Diabetes Information System does is allows us to reach out to our patients with letters reminding them about when to come in for care or if they're overdue for treatment.
For 21st Century Health, I'm Steve Michaels reporting.
Benjamin, there are other diabetes or chronic disease decision support and patient alert systems available. What makes Vermedx unique?
Well, first, Vermedx is very low cost. It does not require data entry or special staff such as disease management nurses. And secondly, Vermedx is the only such system that has been subjected to a rigorous scientific evaluation with an NIH clinical trial.
You claim that diabetic patients enrolled in the Vermedx program benefit in terms of treatment improvement. What are your sources of validation?
Yes, the savings are quite significant. We have data from the large-scale NIH clinical trial, and we also have analyses of insurance claims paid in real-world care settings. In both cases, we see savings of about $2,400 per patient per year.
How quickly are the benefits of savings realized?
We see savings of about $500 in the first year. After that, it goes up year by year.
Let's role play. If I'm a diabetic patient and you're my doctor, how do I experience the Vermedx outreach program?
Well, as a patient, you'd receive first-class mail. You'd get letters from your provider on his or her letterhead. And the letters would be reminders about tests you need or a request to come on into the practice to get special care.
If a health plan or a self-insured employer already has a care management program in place, would Vermedx then be redundant?
Vermedx is so much less expensive per patient than disease management programs that you can afford to offer it to all of your patients, including the ones who aren't on a disease management program currently. If they are under disease management, the reports that Vermedx produces can help your disease management staff do a better job.
It's been a fascinating conversation. Benjamin, thank you so much for joining us.
Thank you. It's been a real pleasure to be here.
And thank you for watching. Until next time, for 21st Century Health, I'm Jackie Bales.